So for everybody to please understand that we're here to watch the MS Advocacy Hub. This is a program that we started at the beginning of the pandemic. It's a way for us to communicate with other MS organizations and other people who have resources or have something that they could bring that's of intellect for the MS community, and that's what tonight's program is about. So for those that don't know me, do know me, don't know me, so there's me, okay, a very younger me, as you can see, because these days it's all gray or white and so on and so forth. All right, so my name is Stuart Schlossman. I'm president and founder of MS Views and News. I am an MS patient, and you will get to know more about me, and you'll get to know more about our guest in a few minutes. Firstly, I do want to let you know that we are supported for this program by Sanofi Genzyme and Biogen and Bristol-Myers Squibb. All right, so tonight we have Dr. Gail Lewis, and Dr. Gail Lewis is a psychologist. She is very well spoken, and we're going to be speaking about things to do with mental wellness and well-being during COVID. So let's get started, okay? Because we're only going to do this in less than an hour today, and I want to introduce you to Dr. Lewis. So Dr. Lewis is a psychologist. She is in Manhattan. She's on the Upper East Side, and jokingly, if she walks fast and there's no traffic, she's about 10 minutes from the water, all right? So she can go for a stroll over there when she's ready to, just get herself in tune with things. So Dr. Lewis, tell me, how are you tonight?
I'm doing very well, thank you, Mr. Schlossman.
That's awesome. You could call me Stuart. You don't have to say Schlossman. It's
Too
long to say Schlossman, all right?
Thank you,
okay.
Stuart.
So before I begin, what can you tell us about yourself?
That's a pretty broad question.
Wow.
What would you like to know?
Tell us about you and your career. What is it that you do?
Well, I'm a clinical psychologist. I'm a psychoanalyst. I'm an MS care specialist. I'm an MS partner in care through the Multiple Sclerosis Society. I am a board certified psychoanalyst. I'm a board certified telebehavioral specialist. And I have been doing my best to accommodate to doing my work as best as possible during COVID by doing this kind of treatment through a screen with people on the other side of the screen.
Right. How's that been working for you?
You know, I think 98% of the people with whom I work have been adapting pretty well to it. And I say these are the people that I've worked with previously when I was in an office. And these people transitioned with me once I started doing this completely virtually, which I think March of last year. I went completely virtually. So all of my patients that I was working with in person came with me. We went on a Zoom platform. And I picked Zoom not because it's the most, I guess, well-known, most used platform, but it's a HIPAA compliant platform, and that's very important for this particular kind of work. And I'd be happy to talk at some point about HIPAA compliancy and this work.
Okay.
But 98% of my patients have been they transitioned very easily to doing this. I've had a few who've been struggling with it, and as the pandemic has continued, struggling perhaps even more because of the lack of being in person. And while this is better than nothing and better than doing phone sessions, in my opinion, it's still not the same as being in person with somebody and having the kind of I guess the physicality of being in a room with someone is lost to a certain extent doing it this way.
So that I understand. So when you were in your office and you made a person got comfortable by being in your office, how do you get them comfortable in a seated position, or do you have them, pull up in on a comfortable sofa or a chair and just to take it easy while they're talking to you?
Well, that's an interesting question because according to a lot of different regulations, American Psychological Association regulations, the American Psychoanalytic Association, both of which I'm a member, and for the Telebehavioral Health Institute, where I did my board certified training in, there are a lot of requirements about just that particular issue. And it's very hard with COVID asking people to adhere to the particular regulations that are ascribed for each organization as to what a patient needs to be able to do in their setting to reflect as closely as possible what would be happening in an in-person office setting. I have colleagues who, for example, because of their particular, I guess, modes of working and wanting to adhere to certain rules, mandate, for example, that patients don't dress in pajamas when they're in session, that they don't sit in their bed, that they do sit in a chair, that they, well, I do this too. I make sure that you have to make sure there's privacy. There's an informed consent that I give to every person with whom I work before we start doing this. It's a telepsychology informed consent, which is different than in-person consent. And it really is, it's about what it means to make the space as safe and private as possible, that is as analogous as possible to in-person treatment, vis-a-vis doing it this way. So, for example, if you were in my office, I would ask you to turn your phone off. There would be a sound machine outside of my office.
Sure.
We were discussing this before we started all this, for all of you who are wondering why we're laughing. So there'd be a sound machine so that anybody in the waiting room wouldn't be hearing what would be going on in my office. So there would be some kind of way to regulate the fact that there would be no noise that would be interfering from the outside into whatever room the patient is in. And there would be no noise that would be where the patient is that would interfere with our being able to fully pay attention to each other. So that would have to be agreed to.
Right. So when a patient, I'm slightly off subject here, but when a patient is doing this with you virtually, can you see their frustration? Can you see their anger? Can you see that there's something that they're wanting to say that they're not saying, like you would probably see in person?
To the extent that I can see it, if it is expressed from the chest up.
Sure.
Unless the patient is standing, which is not common for patients to be standing. In particular, though, when in terms of the informed consent, I just want to go back to that for a second. It's really important when I work with MS patients that the informed consent be very specified to their particular MS symptoms. For example, when I say that they need to make sure that there's privacy and no one can enter their room, if we're talking about someone with MS who has symptoms that, for example, require them to, if they have bladder control issues, for example, I can't say to them, no one can enter your room, because if there is someone who needs to assist them to go to the bathroom during our session, that needs to be allowed. So there needs to be that kind of flexibility in being able to honor people's limitations, and having the kind of training that I have, it allows me to work with this population in a more flexible and in a more respectful way to what their particular limitations and strengths are.
Okay, thank you. So now let me get into some of these questions, all right, because we have quite a few, and people are starting to ask questions online as well, all right, and so I want to ask you first. So you're a psychotherapist, and I'm going to have questions more about other types of therapists as well, but can you share with us what that means, being a psychotherapist? And then I'll ask you another question, because it's just rolling here. So.
Okay, well, I am a psychotherapist, but I more identify myself by my degree and by my licensure, which means that I'm a psychologist, which means I have a Ph.D. and I have a license to practice psychology. So a psychotherapist, pretty much anybody could be a psychotherapist. You could be a psychotherapist.
I think I already am.
Really anybody can call themselves a psychotherapist without a license, without particular training. You can hang a shingle on your window and you can be called a psychotherapist. But I am a trained, educated psychologist where I had schooling and clinical experience, passed a licensing exam, and that allowed me to become a clinical psychologist. I'm actually a clinical child psychologist.
Okay. So do you deal with a lot of more children? And let me ask you another question. Do you deal with a lot of children with multiple sclerosis?
I don't really work with children anymore.
Okay.
I work with adolescents. I do not currently work with any adolescents with multiple sclerosis.
Okay. Okay. All right. How did you become involved with multiple sclerosis patients?
Well, that's an interesting story. At least I think it's interesting. I hope that you do as well. So I do believe I was working with one woman in my private practice with multiple sclerosis, and this was many, many years ago. I was trying to find ways to build my private practice. So at the time, I would send out bulk mailings to particular populations of recipients. And at this point, I think I was mailing letters with my CV and with cards, introducing myself, talking about how emotional issues can get communicated through bodily symptoms. And I think I picked neurologists. I just happened to pick neurologists at this one time. And I got a lot of referrals that way, with doctors never having spoken to me, never having wanted to meet me. I think I wrote a really good letter, apparently. But one doctor in particular, and I want to call out his name, and he passed away several years ago, Dr. Joseph Herbert, who led the MS center at NYU Langone Medical Center. It was the MS Comprehensive Care Center. He wanted to meet with me. So I met with him, and he asked me about my practice, my experience working with MS, and 5 minutes into our conversation, he offered me a job. And I said I didn't know it was a job interview, and he said I didn't know either, but I think you'd be a great fit, which was incredibly flattering. And in some ways quite unusual, because I am a psychoanalyst. He knew I was a psychoanalyst, and he knew that meant that I work from a long-term treatment model, which is not supported for the most part in hospital settings and in insurance settings. But I believe, because MS is a chronic disease, it should be treated in a long-term treatment model. So after about a year of going through a lot of political bureaucracy and lots of interviewing with different people at the hospital, I was credentialed there as an assistant professor of neurology, and he basically let me run my own little private practice at his MS Comprehensive Care Center. Good. And that's how I became involved working with MS.
Okay, great. I was going to ask you what, if anything, particular drove you to doing psychology in itself?
Oh, really?
Short. Short answer.
Okay, short answer. Let's see. I wanted to, let me see. I initially wanted to be an attorney. And the reason why I wanted to be an attorney was I wanted to become a divorce attorney. And I was working in a law firm, told one of the lawyers I wanted to be a divorce attorney because I wanted to make sure the children that were involved in the divorce process were having their needs met and that they were being tended to in a way that I thought that they needed to be tended to. To which he responded, that's not what a divorce attorney does. That's what a therapist does. So senior year of college, after I took the LSATs, I did everything I had to do to apply to become a psychologist, to go to a Ph.D. program in psychology, and here we are.
Okay, gotcha. All right, well, thank you for those answers. Now let's get going into more involved questions here, okay? What are a few of the more prevalent emotional challenges for people living with MS?
Well, it is known that at least 50%, probably more, of people with MS have an undiagnosed diagnosis of depression, probably equally so with a diagnosis of anxiety. And I say undiagnosed because of a few factors. One is that because of managed care, neurologists usually have 15 minutes maybe to do a neurological exam. And during that time, one's mental health is usually not on the top of list of questions that neurologists are asking about. And people are often ashamed of having mental health struggles and acknowledging that they feel depressed. So they're not necessarily forthcoming in telling their doctor that they have depression. And also, very often when people go to see their neurologist, they're nervous, they're anxious about other things, and it's not top of mind for them to report it, nor do they necessarily think that it's relevant to their MS. So they might not be telling their physicians that they have MS, that they have depression, for example. So it's untreated, and it's one of the easiest things to treat. And also, there are various reasons why people could have MS, could have depression because of their MS. It could be directly related to where a lesion is located in their body. It could be directly related to the reaction of having MS. It could be due to a reaction to the medications that they're taking. And a lot of people also have a predisposition to depression prior to an MS diagnosis. So for some people, they don't see it as related to their MS at all, and they wouldn't necessarily be reporting it anyway. So it's just anxiety and depression, and I'm just going to put them together. They're not treated, and they're so easily addressable.
Okay, thank you. So living with MS can be challenging also for a couple. From your experience, can you share some of these challenges?
I think one of the biggest challenges that we can probably put that that is probably the overriding issue between couples is communication. And when the couples, this can be for whether or not MS is present, or not. If couples are not communicating honestly with each other, then their feelings about whatever is going on with the other person, they get suppressed, it gets acted out, it's not communicated in a clear way, and resentments form. And when somebody has a diagnosis of MS, depending upon the severity of their symptom profile, it might mean, for example, and let's take it to a more severe state. Let's say that someone with MS has to leave their workplace because they can no longer function in a workplace. And this was, say, a 2-salary family home. So the other partner, therefore, will now have to pick up the slack, the financial loss of the MS patient's salary that is no longer being brought in. So what does that mean in terms of the partner's time that was spent perhaps doing other things? They now have to find a way to have more earning power, to maybe take on a second job, maybe pick up some of the slack of some of the responsibilities that the MS person was doing at home that they can no longer do. So it can put in a very unexpected burden on the support partner because of the person who has MS no longer being able to do some of the things that he or she was able to do prior. And if these things don't get talked about, it can already feel very challenging, and it can inspire a lot of resentment in a support partner, who also might feel very guilty for feeling resentful about having to do these things because the person they love, the person they're with, is suffering from a disease that was not invited in, that was not asked for, that the person doesn't want, that nobody wants. But now they have to do so many more things that they didn't have to do before, and they might be really angry because this is not what they signed up for, and this is not how they wanted their life to be. But they feel very uncomfortable expressing this to their person with MS because they, again, feel guilty for feeling that way, and because they feel like it might not be a welcome thing to say, that their person with MS might not feel like their feelings matter as much as their own suffering matters. And things don't get talked about. And this can create significant rifts in their relationship.
So how do you speak to the care partner or the caregiver, whatever you want to call it? How do you speak to the person who's feeling the load that they're feeling, that, yeah, they have to do that much more work now. They have to, if they have children, they may have to spend more time with the kids. So now it's not just working extra time to make up for the additional income that's needed, but then coming home exhausted and now also having to take care of children. How do you speak to people like this? I mean, what is the ringer that you can throw to them? You know, the life ring, whatever it's called, saver, to make it easier for them, to make it more palatable for them.
Well, I ask them, the way that I work in my practice, and I've always done this, is that when I start working with someone who has MS, who has I call them support partners. I don't necessarily call them caregivers because I think they're doing a lot more than caring. I invite them in to my consultation space, both with the person who has MS, but actually more importantly alone, because I think that they're not being paid attention to in the way that they need to be paid attention to. I give them the space to be able to talk about what their feelings are and to validate and empathize with the difficulties that they are experiencing, and to normalize it, and to let them know that what they're feeling is real and allowable and important, and just as important as what their MS person is feeling. So I regulate it for them. And I think for anybody having any kind of stress, when you talk about it, it can have the capacity to relieve some of the pent-up energy that's being attributed to holding on to it.
Understandable. Is there any way that you can supply a person, a caregiver, with a resource for getting in touch with others that are in similar positions as them? Where do you point them to?
Well, unfortunately, these days, the National MS Society, they used to have so many support groups
Right.
that I would have referred them to. But unfortunately, a lot of those groups are no longer being offered. I think that organizations such as yours could be an excellent resource for them to be able to find other people like them that they can find some commonality with, and they can find a way to share their experience. Another wonderful organization that also has a significant focus on working with support partners is Can Do MS.
Right.
And they have a variety of programs, all of which have specific time cut out, especially for giving support partners their own space to talk in a group setting with other support partners about the kinds of stressors and the kinds of experiences that they have had and that they're experiencing, so that they don't feel so alone. And it usually takes, one person to dip their toe in to what feels like a really frightening thing to admit, because of, again, the guilt, the feeling that their feelings shouldn't matter as much as their person with MS. But when one person starts the ball rolling and admits that they're having a really hard time, it becomes a welcoming beacon for all the other people to start acknowledging, yeah, this is really tough. And it's okay that it's tough. And it's reasonable that I'm feeling that it's tough.
Thank you. So in the past, though, to get people, caregivers, care support partners, to get them together at a meeting was difficult because they're really spread out. Those that need this. But now with all this virtual learning, is it possible then do you know somebody that can do a Zoom meet for care support partners? You know anybody that does this?
I don't, but that certainly is something that I would do.
Right. That's what I was pushing towards. That's exactly what I was pushing towards. So you just filled one of my boxes, okay? Because now we have you labeled to do something like this, all right? And I'll speak with you about that separately, okay? All right. So, all right, next, MS touches, the entire family. And how can families get help as a whole? So now you have not just the MS patient and not just the support partner, but what about the children, or what about the parents? How do you get them all involved as a group to work with each other?
I can only speak for myself, because I don't. There are other MS care specialists around the country, and I know that the National MS Society have MS partners in care, and they have on their website, they have a whole space for referral sources. So there are people that the MS Society themselves have vetted and have acknowledged to be MS specialists who may or may not do the kind of work that you're suggesting. I myself, I do that kind of work. So if, again, when I start working with someone who has MS, I let them know at the beginning that because MS affects not just themselves, but affects the microcosm of people around them, including the support partners, including children, including whoever is in some ways directly or maybe even indirectly affected by their MS, that they are welcome to come into my office and welcome to talk about what their experiences are like. And that it's a neutral space and that it's a non-judgmental space. And I'm an incredibly boundaried person, and I want to point that out, because some people might be questioning whether or not that's a kosher thing to do, having different family members in the same office with one therapist. If things need to be shared, we make agreements ahead of time about what can be shared, what's not going to be shared, and that is decided and it is stuck to. If for some reason something comes up that I feel was initially agreed upon is not going to be discussed, but I think it would be really important for us to discuss as a family, as a couple. We talk about it. I can't necessarily force that conversation to take place, but I would use my professional recommendation in making a statement as such.
So when they come into your office as a group, do you have a metal detector?
Stuart, why are you asking me that question?
Well, you don't want violence in your office, that's why. Gotcha. It was just a funny thought, that's all. All right, next.
There could be yelling. No, I have rules in my office. I mean, obviously I can't.
That's
different here. I have rules in my office that you can say whatever you need to say. You can do whatever you need to do, but there are rules. You can't hurt me, and you can't hurt my office, and you can't hurt each other.
That's a good thing. That's why you need a metal detector, though. All right, so next thing, thank you for all those answers. That was great. And by the way, we will definitely be speaking about that other topic, okay? About putting something together. So I'm going to take a couple questions that are coming in online. I was going to try to keep it to like where you're discussing something, but so a person named Cindy just wrote, since depression and anxiety so often go untreated, would you recommend when seeing the MS doctor, who only has 15 minutes to interrupt his or her agenda and basically make the doctor acknowledge the issue and respond? Is it something that you tell patients to do?
I do. Obviously, you can't make your doctor do something, but I think that you are your best advocate. And if you feel that it's important enough to talk to the doctor about, then you bring it up. For some reason, if the doctor is not acknowledging it in the way that you feel you need to have it addressed, then ask to speak to one of the nurses. Most doctors' offices don't necessarily have a comprehensive team available, but they most likely will have at least a nurse with them. So I would talk to the nurse if the doctor is not giving you a sufficient answer or a sufficient time to talk about your depression or your anxiety. It deserves to be attended to.
Okay, thank you. Also, Tammy is asking, and I'm not too sure of her question, but I'll try to say it anyway. Is it normal for MS anxiety or depression to uncover long ago PTSD symptoms?
Oh, yes.
Okay.
I consider multiple sclerosis in the category of trauma, and I think it's a chronic trauma. And when one has a trauma in one's life from early in life, it stays with you. It stays it becomes part of the fabric of your inner world. So when additional trauma happens, such as the diagnosis, such as living with the uncertainty of this disease, and living with symptoms that just erupt out of nowhere, that will set off old traumas, and that will bring up unexamined and unprocessed old traumas, even processed old traumas it could bring up. So that is that's a really good question, and it's very understandable if that were to happen. Yes.
Right. So how do you work? This is not part of my questions, but how do you work with a person with PTSD that's been sitting in their body and being disruptive to their life? I mean, where do you start?
Well, that's a whole and that's an entirely other webinar.
We'll deal with that another time. We'll deal with that another time.
But I can just say that I specialize in trauma, so it's something that you have to work with very gently, and you have to be willing to go to places that are very painful and very difficult, and often have been internalized in a very unworded, fragmented way. So it requires a lot of patience and a lot of kindness and a lot of empathy.
Okay, thank you. All right, next, can you share with our audience how someone may recognize when they or someone in their family may consider reaching out to a mental health professional?
Can you ask that again? Say it again.
I can, but it might come out a little bit different. All right, so can you share with our audience how someone may recognize when they, the person that's feeling it, or someone in their family may consider, may want to reach out to a mental health professional?
Okay. Well, when you notice the person or yourself struggling and not being able to manage whatever it is you're struggling with in ways that you had been able to manage it before, meaning the coping mechanisms that you had previously been using are no longer as effective as they had been before, that would be a reason. If your mood and your feeling states are interfering with your capacity to engage with other people, interfering with your capacity to take care of daily hygiene, for example, to be able to manage in your daily life, to be able to get your work done. If you find that your attention and your concentration is being interfered with interruptive thoughts and feelings, those are good reasons to consider reaching out to a mental health professional. If you're finding that you're getting angry in a way that might seem to be above and beyond what is happening in the situation, that would be a good reason. If you're getting into fights more, if you're finding yourself crying more, if you're finding yourself being more disconnected, withdrawing from people, if you're finding that you have no desire to do the things that used to give you pleasure, those are a lot of reasons that might be suggestive of reaching out to a mental health professional.
Okay, great. Thank you. You're board certified in conducting telepsychology sessions. Can you please explain what this is all about?
Well, it's about having gone through a course through a and being certified through an organization that teaches about doing telebehavioral health vis-a-vis this kind of platform and by a phone platform. And what it talks about HIPAA regulations, and just to clarify, I'm sure many of you have heard about HIPAA. You usually hear about it when you go to a doctor's office and you sign one of those privacy notices. And it's basically about making sure that your safety and your privacy are protected. And so it teaches, I learned how to do these kinds of sessions, making sure that safety and privacy are protected and records are protected in the same kind of way that it would be protected in an office setting.
All right. Can you please tell us the difference between a psychiatrist, psychologist, social worker, and a counselor?
Okay, a psychiatrist is somebody who has a medical degree and who has gone to medical school and has specialized training in psychiatry in their residency after medical school. A psychologist like myself is someone who goes through a doctoral program, who has a Ph.D. and who has a license in practicing psychology. A social worker is someone who goes to social work school, and a social worker primarily addresses concrete issues of life, helping people, for example, if with MS they need to, they have ambulatory issues. So they help put them in touch with organizations that will provide them with walkers, with canes, with wheelchairs. They'll help connect them with organizations that help with people getting jobs if they have a disability. They will help people. I'm sure you're familiar with an organization called Access-a-Ride. They'll make the connection with that. It's more providing concrete services. At the same time, there are a lot of social workers who will get additional training a year or two after their social work degree, and they will become psychotherapists. So they will offer psychotherapy services in a similar way to a psychologist. Oh, and the other, just to go back to a psychiatrist for a moment, while yes, they have an MD, so a psychiatrist can offer psychotherapy. Most psychiatrists these days, we also call them psychopharmacologists. They will prescribe medication for psychiatric issues. Visits are primarily focused on prescribing medication. And a counselor. You can be a mental health counselor, and you can have had training in becoming a mental health counselor, which is not dissimilar from becoming a social worker, I believe, but it's shorter training than a psychologist and a psychiatrist. And you didn't ask, Stuart, but I'll say a therapist, a psychotherapist, anybody can be a psychotherapist. You do not need a specific degree to become a psychotherapist and to call yourself a psychotherapist. You can just put a shingle out on your door and say you're a psychotherapist. Okay, so one of the questions that was going to be asked to me is how the pandemic increased the need for these kinds of services. And I think that in addition to the more, I guess, common mental health struggles that people with MS and their support people have been dealing with, the pandemic has increased felt and actual isolation because of the lack of mobility, not just mobility issues due to your MS, but the lack of mobility due to requirements of staying inside. So that has increased issues around feeling isolated, which is associated with feelings of anxiety and feeling depressed, and has increased issues around marital struggles because prior to the pandemic, there, if able in a couple dynamic, one of the partners would be leaving to go to work. But now, since people have been working from home, there is the lack of separation between them. So that has created a lot more friction in couples. There's been an increase in domestic violence and domestic struggles because of the pandemic. So the need for mental health care, and there's a longer list, but I'm just to keep it brief, it's become much more emotionally challenging, I think, for everybody to have to deal with all of the unknowns and all of the restrictions that have been put on our lives. And when it comes to MS, which already has imposed an unwelcome restriction just by the diagnosis alone, when you add over 18 months of many more unknowns that continue to evolve, and feeling as if our lives have been so profoundly changed and so profoundly impacted by a lack of being able to move freely, it affects us in so many emotional and mental ways.
Great, thank you. So can you tell me what questions you did?
I just did one question. I did how the pandemic increased the need.
Okay, great. Thank you very much. So I am back on, as you can hear. I am not speaking through the laptop. I'm speaking through the voice communication. And wow, good thing we have technology, right? By the way, thank you for carrying on for a moment, okay?
No problem.
Can you please share with us new and/or challenging policies that have impacted telehealth and access to mental health resources?
Well, I think one of the biggest issues that have actually been beneficial from the pandemic and might also now proved to be problematic because of the pandemic, has to do with licensure to practice across states. Because of the pandemic, there's been much more fluidity between states and practitioners, mental health practitioners being able to treat people who do not live in their states. For example, I live in New York, and as a licensed psychologist in New York, prior to the pandemic, I was only able to treat people who not just lived in New York, but were actually located in the state of New York when we would have our session. The reason I became a board certified psychoanalyst was so that I would have a credential that I now do that allows me to work across most states. I am now considered to be a licensed psychologist in most states. And that's because of my particular credential. But because of the pandemic, many of the organizations, the psychological organizations and social work organizations and psychiatric organizations have allowed more fluidity between the states for the practitioners to be able to offer mental health care across states. And that has been incredibly beneficial. But I'm not sure how that's going to change post-pandemic. Even though it has been very successful, and I think across all of telemedicine, telehealth has been very successful, I'm not sure what is going to happen post-pandemic and the permissiveness between the organizations and licensure for practitioners to be able to offer cross-state treatment.
Okay, thank you for that. Somebody just wrote in asking if Dr. Lewis is licensed in Tennessee.
You know what? I have to look. I don't have my list of states in front of me, but by all means, if you want to contact me, please contact me, and I'm sure Stuart will help you find a way to do that. And yes, I would be more than happy to let you know if I practice in Tennessee.
Right. Thank you for that. So for anybody on the call that wants to reach out to Dr. Lewis, just contact me and I'll give you her information, okay? Okay. All right. So that's a great thing that comes up on one of our upcoming questions. How can our listeners find you?
Okay. Well, there are several ways. If this sounds so old-fashioned, if you have a pen and paper.
You don't have to. I'm going to type it in. I'm going to type it into the to the chat box. Okay.
Okay. So I have a website. It's msteletherapy.com. I'll spell it for you. msteletherapy.com.
Yeah, I already got that. Okay. Next. Or how do they email you?
Don't make faces at me. I'm trying to help.
I picked it up. I know you are. I know you are. What is your email address that they can write to?
It's better to go on the website, and it's
gotcha.
It's a little wordy, but I also I can give you my phone number. It's 212. You writing it?
Okay.
212.
Yep.
360.
Yep.
5675.
5675. Okay.
And there
212-360-5675.
Yes, and there is a place on the website where you just have to fill out a little form, and it'll get sent to me immediately, and I'll have all of your contact information, and I'll be able to get right back in touch with you.
Okay, you could get in touch with me, but they may want to get in touch with you too. All right, next. Thank you for that. So can you provide our audience with any online places about mental health and wellness? I mean, we know that the National MS Society has this. I don't know which other organizations do have that. So if you know of any, can you please let them know about this?
I know that Can Do MS has a great have great resources. They have I guess archived webinars, they have articles, they have question and answer pages. They're terrific. On my website, I have a page of resources that that might be very helpful. I guess it depends what kind of resources you're looking for.
Sure.
Yeah.
Sure. So to let everybody know that MSU News also has plenty of resources available, and we also have a mental health chat series that's happening once a month, and that's with a licensed clinical social worker named Jessica Thomas. So she's doing this program with us, and we'll be continuing it all through 2022 as well. So, and then we have a lot of our own programs that you can go to our YouTube channel and type in mental health or depression or whatever, and it'll come up and open up to different programs where we've had these discussions. And we hope to hear a lot more from Dr. Lewis, because we got all these great things that we're going to be doing, okay? Okay. All right, awesome. So any final thoughts? What would you like to share with our virtual audience? Anything that I haven't asked you that you may want to bring up?
Yes, I think I touched upon this before. I think it's quite unfortunate that even in 2021, people are still feeling quite ashamed about acknowledging that they struggle with mental health problems. It's still stigmatized. And I know in many communities, many cultures, you don't talk about anxiety and depression and any other kind of mental health problems with strangers. And that's, that's fine if you can find some person within your community that you can speak about what's going on with you. It's very toxic to keep your feelings inside. It's very toxic to not communicate what's going on. You might think it's better for yourself and for the people around you to not share what's going on. You might think that it's less conflictual, it'll cause less problems in the relationship if you keep what's going on to yourself. But it actually, especially when you're dealing with multiple sclerosis, your neurological system gets activated when we have internalized pressure that keeps building and building. And we don't want that to happen. MS, you have an overactive neurological system. You do not want to contribute to that by keeping your emotional world inside. And it's important to find a safe person, and it might take a few tries to find who that safe person is, that you can talk to, and that you'll let them listen and let them hear what's going on, and help you also listen to what you're saying and what you're thinking and what you're feeling, and help you find different perspectives and different constructive ways of being able to manage how you're struggling, so that you're not doing it all by yourself. You don't have to do it by yourself. There are resources out there.
Great, thank you for that. And one of our viewers who's a support group leader in the Miami area, her name is Maria. She also wrote, it's very toxic to keep things inside. That's why support groups are so valuable.
I agree.
Okay, great. Thank you for that, Maria. All right. By the way, Maria is going to be a guest of ours on October 6th. So we're having Maria. We're having a couple of National MS Society self-help group leaders that will be on speaking with me in our MS Patients Voices program. And Maria is one of those people I hand-selected. Okay. All right. So, Dr. Lewis, I want to greatly thank you for being on here tonight. I'm sorry for the internet problems that we had here tonight. There's nothing I can do about it, that's for sure. I can't even say it's in God's hands. I don't know whose hands these are in, so I'll have to blame it on the power company down here, or blame it on Comcast, all right? They're a good one to blame it on.
It's part of the flexibility that we need to be dealing with these days, yeah? That's
right. So I know that there were a few people that left the program. I guess they thought it was like ending because I wasn't here, but we will send them the link to watch the full video afterwards, and once we get this posted to our YouTube channel. So for anybody that's remaining, please know that this is going to be published to our YouTube channel in about 1 week. I am a bit far behind right now. We are doing 10 to 11 programs a month. So listening to all these things and getting my video crew to get them to me quickly sometimes gets slowed down. But Dr. Lewis, again, thank you very, very much for being here. I can't wait to get you into doing some other programs with us, and we'll get this all wrapped up soon, okay? And we'll get something going, all right?
Thank you so much for the opportunity, Stuart. I really appreciate it.
Thank you. Thank you very much. You all have a great night. And remember, we have lots of programs. Go to the MS Views and News website, look in the center column, and we have a slew of programs happening in the month of October, including our annual symposium, which is on October 16th. It is a 4-hour event with multiple speakers, including Dr. Aaron Boster. So we do hope to see you on October 16th. Thank you, everybody, and I'm going to say goodnight. Ciao. Poof.